Join me right now on set, the author of the brand new book, let me hold this up here, The War on Guns. Here you go. Arming Yourself Against Gun Control Lies. Dr. John Lott is sitting down right next to us. Dr. Lott, how are you doing, sir?
Doing great. Good to see you.
It's good to see you. We also have NRA past President David Keene joining us on the program right now. David, we'll let David get his headset on, because otherwise you won't be able to hear him say hello anyway. So are you having a good CPAC?
Yeah, no, it's been fun. Seeing lots of people I haven't seen for a little while, so it's good.
Yeah, and a lot of interest in the War on Guns, the new book, too.
Well, thanks. Yeah, I think it's probably my best book that I've written on guns. So,
and that's saying something, because you've written some good ones, Dr. Lott.
Well, thanks. Try to get out there. Of course, we have another author right here, but you had a book that came out right before the election.
That's right.
And his is a good book. It's a good reference book. It's got the facts in there. It's what John's done very well for a career that's had real impact on the gun debate.
Well, David Keene and Ray
So I say you have to buy both books.
I was going to say, your book.
Maybe we get a discount if they buy them together or something like that.
David, your book is Shall Not Be Infringed, correct?
Right.
And help me out. I saw the subtitle yesterday. It's New Fights or something about the new fights that we face here in the gun control debate.
Yeah, mine's more a narrative of what we've gone through, where we've come from, and what we're going to be confronting, and references some of the things that John goes into in his book. But if you're going to engage in the debate, you got to know what I wrote, and you got to have the facts that John details in his book. So I think you're right. People should go out and buy both of them.
I do too. Listen, I'm telling you, arming yourself with facts.
And let's not undersell it, John. No discounts, darn it.
But, really, arming yourself with facts is so important now, because we do live in a day and age of fake news. We live in a day and age where, frankly, there's been a lot of either intentionally dishonest reporting on this issue, or a lot of people who are reporting on these issues and they don't know anything.
Yeah, some of it's simple ignorance. Some of it's that they picked up something somewhere that they have no factual basis to believe in, and some of it's an outright lie. And if you're going to counter that, you have to know what you're talking about. You have to be able to go back to the actual facts, to the actual statistics. You have to be able to know what happened, and you have to be able to say, wait a minute, that just isn't true.
So, for instance, you've got a chapter here, Dr. Lott, the tidal wave of public health research. Now, I didn't think we had a tidal wave of public health research on gun ownership, because I thought that the NRA had siphoned off and said to the CDC, you're not allowed to even look at these things anymore. Right. You're telling me that people are actually still doing research on firearms and gun control and things of that nature.
Right. Well, I mean, the claim that there had been a
research, maybe? Is that maybe the better way to say it?
No, I mean, even taking it the way they wanted to define it, the claim that there had been this big drop-off in firearms research was from a Bloomberg paid report, where what they looked at was medical journal articles, the percentage that were on firearms versus something else. Firearms research in medical journals actually was fairly constant after the 1996 Dickey Amendment. What happened is that medical journal articles on other topics soared. So as a percentage, it fell. But they still were getting, because there were new areas of medicine opening up and what have you. But if you look at the last 5 years or so, it's exploded. It's basically gone up about fourfold in the last 5 years, because you've had Bloomberg and others pouring money in. But one of the reasons why it didn't fall is that if you look at medical journal articles on firearms that were funded by the government, it was no more than about 3%. When you get funding for a medical journal article, you have to put in the article that you got funding and who you got it from. And so we went through all the old articles, checking to see how many of them got tagged that. So, the Dickey Amendment, if you actually read it, just says that they can't go and use federal funds to lobby.
That's correct.
It's nothing to do about research. But I'm saying even if it had eliminated it, which it didn't, it accounted for such a tiny percentage.
But John hits the right point, and that is, if you go out into the discussion, somebody's going to say the NRA went to Congress and got them to ban research on firearms and firearms deaths and the like. Never happened. Untruth. Fake fact. Mm-hmm. The fact is that they were using the Center for Disease Control and this federal research not to do research, but they were funding, during the Clinton administration, they were funding the effort to lobby and to go after guns. And what the amendment says is not that you can't do research, is that you can't use those federal funds to lobby.
Right.
Right. I mean, there's so many errors here. Claiming that it had fallen off, claiming that researchers were leaving the area. None of those things are true. It's just you have a bunch of academics who want to get more money. So they go and claim that, geez, we need to get more money. We're not going to be able to go and do the research. But, one of the other things that go through in the war on guns is just how poorly done the public health research is. These guys are like 40 years behind the times in terms of statistics, in terms of knowing how to use it. I mean, I could talk to you for hours about it, but it's just, personally, I think society would be better off if they stopped doing research, but it's just...
On everything?
Well, no, I mean, I'm just... look, I mean, the thing is, they use statistical tests that are applicable to other areas, like, let's say, testing a drug, to looking at social phenomena. So let me give you probably the most famous claim that's made from the public health research. That's the claim that owning a gun in the home is more likely to result in the death of you or a loved one than it is to result in the death of a criminal. What they would do is they look at deaths over a course of a year, ask, somebody who died near a home, they would ask the relatives of the deceased whether the person owned a gun. And they just assume that if you died from a gunshot in a home and the gun was in the home, there was a gun in the home, that it was that gun that was used in the death. Even when you include suicides there, at most about 14% of the deaths could be attributed to the gun that was in the home. The other 86% were due to a gun that was being brought in from the outside. You just fix that one thing and it reverses their claims. But there's a big fundamental logical problem here. And let me give you a simple example, if I can. Let's say we were to take their test and apply it to hospitals. Because what they do is they look at people who died, and then they go and look at people who are the same age, sex, and race who live within a mile of the deceased in the gun study. And they ask them whether they own a gun. And then they run a regression on whether you died, on whether you own a gun. If we did that for hospitals, we found people who died in the Washington area over the last year, ask their relatives whether they've been to the hospital, and then go and find people who are the same age, sex, and race who live within a mile of the deceased, whether they've been to the hospital. My guess is you would find that people who went to the hospital were more likely to die. Are we going to go and lobby to get rid of hospitals? No, because it's silly, because there's a reason why some people went to the hospital. They were sick.
Yeah.
There's a reason why other people didn't go to the hospital. They weren't sick. And what you want to do is not compare a sick person to a healthy person in terms of whether they're going to die. You want to compare two sick people. And the same thing is true with the guns thing. Maybe somebody was owning a gun because they were in a gang. Maybe they were owning a gun because their home had been broken into multiple times in the past. And so you have to take into account why one group owned a gun and the other didn't. And simply saying they're the same age, sex, and race and live within a mile isn't going to get that for you.
Talking again with
Sorry
Dr. John Lott.
No.
No.
I mean, that's probably but it's just a simple example of how poorly done the statistics are in the public health area.
I want to ask about one more lie here that we're hearing, and we heard it from the Fourth Circuit Court of Appeals this week, David. This is the lie that machine guns and semi-automatic firearms are really, almost exactly alike, and these are modern battlefield weapons of war, and therefore civilians shouldn't be able to own them. In fact, they don't fall under the protection of the Second Amendment.
Well, there are two questions there. One,
yes.
Are semi-automatic weapons, the
Weapons of
AR-15
war.
is an example, are they weapons of war? The answer to that question is no. The second question is if they were, and if they were commonly owned and widely used for legal purposes, would they not have Second Amendment protection? The answer to that question is they would have. But the first question is the crucial one. That decision, in my view, was dead wrong because in the Heller decision, it was as if in writing the decision, Antonin Scalia looked at what the Clinton administration had done and said, let's just include a paragraph that says there's one kind of weapon you cannot ban, and that's a weapon that's widely owned and commonly used for legal purposes. That would be the AR-15. And for the judges there to assert that that was not covered by Heller was just plain wrong.
Well, the other part about even saying, even if it was a weapon of war, Scalia, in his decision, didn't even deal with those things. He was very careful to narrowly tailor this to the question before the court at the time, and that was whether or not D.C. could go and ban handguns. The rest, he just said, we're not taking a stand. You know, it's possible there could be other laws that we could uphold, but they didn't make a decision.
Well, they essentially grandfathered old regulations. For example, the ban on the machine gun, the short-barreled shotgun, and the like. But then they included hypothetically what you couldn't ban, which was the widely owned and commonly used gun, which would be the AR-15 and others.
Yeah.
The case itself is, John's exactly right, is as it should be, narrowly decides the question before the court. But in interpreting the Second Amendment, they went into this historic reasons what the Second Amendment meant, where it came from, and what it covers and doesn't cover. So while they didn't get into that question, the answer to that second question is, if this was a weapon of war, would the Second Amendment, as construed by the founders, necessarily ban it? The answer is no. The question of whether a legislature might, for example, if it was a rocket launcher or a nuclear weapon or something like that's a whole different question.
Well, the court in the Catano guidance that was issued last year said, prima facie, any bearable arms are protected by the Second Amendment. That was their statement. It was pretty simple, right? Yeah. On the face of it, if it's a bearable arm, you have to assume that this is a protected firearm. You want to make the argument that it's not, make that argument, but on the surface, it should be presumed to be protected. David Keene, NRA past president, the co-author of the new book, Shall Not Be Infringed. Dr. John Lott, the author of the new book, The War on Guns. Here, I'll put it in front of Dr. Lott's face. There you go. The War on Guns. Both available now. Gentlemen, thank you so much for spending some time with us today.
Thanks very much.
Always good to see you. Thank you so